Everyone, I'm Ryan and I'm an Australian physiotherapist specializing in spinal conditions and athletic sporting injuries. And we create programs to help you go from injury back to full performance and function. Today, we're going to be talking about the Spinal Benchmark Test, which is a series of 4 tests that help us determine how strong and how much endurance does the muscles around your spine have. This is a really important test that we do when we're looking after our clients with spinal injuries to help them figure out what are the main contributing factors or areas of weakness for us to focus on while we are developing our programs to help you get you out of pain. So the 4 tests include, number 1, a back extension hold where we're looking at the muscles in the back of your body or back of your spine. Second test is we're looking at a trunk flexor hold. So we're looking at the muscles here, or commonly known as your abs, to see how well or how long they can hold you in a bit of a sit-up position. And the third and fourth test is going to be a maximum side plank hold that assesses how well your lateral stability is, which is a very commonly overlooked area in our spine. So stick around to have a look at how we do the tests and how we time and record each test. Once we get the result of each test, which is basically how long you can hold each position for, we put it into our spreadsheet, which has our formulas. And what it will tell us is, what is the ratio, or do you have a healthy ratio of the trunk left to right, or your trunk flexes to your extensors? So we're looking at ratios. If one side is significantly stronger than the other, we know that we need to fix that discrepancy or that asymmetry. And one other thing to note is that this test that we do gives an overall picture of our capacity, which means how well your muscles can function and perform. But it doesn't necessarily tell you what's causing it. What it tells you is that maybe there's particular muscles here that are weak that are contributing to your condition. It's not causative, it's contributors. So even though it is not telling you exactly what's going on, it's still a really valuable tool to guide us exactly to make sure we know that where we are going in our rehab programs is specific for you. So stick around to watch how we do it, and I hope that you find it helpful. So for the isometric back extension portion of the spinal benchmark test, we're going to be here on this GHD machine, and we're doing an isometric back extension hold, and we're timing how long you can hold that position before you start to break parallel or if you start to feel pain. So that's when we stop the test. So let's get set up in here. You're going to sit yourself up. The arc or the height of the pad should be just below your hip. Hands off, keeping your trunk as parallel to the ground as you can for as long as you can. You're going to time that, or you stop the test if you start to get pain in your back, and we note that down on your record. All right, so we're now coming to the trunk flexor endurance portion of the spinal benchmark test, and we're going to do it with almost like a sit-up hold. The way I like to do it is you'll be lying down here on your back with your hip and your feet on the ground, hands on your thigh. You're going to come up to your knee and then cross your hands. Hold that position for as long as you can. As soon as you start to drop down, you stop the test, or if it starts to hurt at a certain time, then you stop the test and we record that as well. All right, so this next test is a maximum side plank hold. So you're gonna have your forearm underneath your shoulder, your legs nice and straight, and your body is in a nice straight line with your legs. You're gonna hold this position for as long as you can. If your hips start to drop down, we stop the test. Or if you start to get back pain, we stop the test and record your time as well. So what are we actually measuring in this test? So firstly, we look at your capacity scores. And so here I'm just putting in some numbers. When it comes up as red, it means that you've got some work to do. If it comes up as green, it means you're looking good. Secondly, we look at ratios. How well does each component stack up against each other? And are there any major imbalances? And lastly, we compare you to phase norms. Where do you stack up against other people around your age who are not in pain? Now let's check out 3 exercises we give to help improve your scores. What we're going to do is going to keep your back nice and neutral, so not too extended. Hands across your chest and just holding this position 20 to 30 seconds. So your back's nice and flat on the floor. You've got a slight chin tuck. Once you've got that position ready, holding on to two ends of a band, you're gonna pull with a straight arm and you're gonna hold that position there for 20 to 30 seconds. So next what we're doing is a side plank or an abduction isometric. So you're just gonna be up on your forearms here, keep your hips up nice and high, and you're holding it for 10 to 15 seconds.